Hello, I'm Dr. Meenakshi, Consultant Obstetrician Gynecologist at Medicover Hospitals, High Tech City. So today let's discuss an important aspect of a lady's life, contraception or preventing an unwanted pregnancy or helping spacing of pregnancies. What are the options that a couple has? We can determine short-term options, intermediate and permanent options. So when we're talking about short-term options, we have options of condoms, abstinence or the contraceptive pills. When we talk about abstinence, not always possible. When we talk about condoms, that is a barrier contraception. It helps prevent pregnancy by preventing the sperm coming in contact with the ovum. These are very useful, especially for preventing sexually transmitted infections and also when occasionally intercourse happens. The protection rate of condoms is about 80 to 90%. Main advantage not given by any other form of contraception is it prevents sexually transmitted infections. When we talk about month-on-month basis, what are the options that a lady has? Combined oral contraceptive pills, or what we know as the hormone pill or the pill, these help prevent ovulation. So when we prevent ovulation, there is no egg being released and hence there is a very less chance of pregnancy. When used correctly, an oral contraceptive pill can give protection up to 99.9%. Does it have gross disadvantages? No. It has more advantages than disadvantages, but definitely some risks are present with the oral contraceptive pills in a certain population of patients. So having a checklist with your gynecologist before starting the oral contraceptive pill is important. How does it work? It works on a month-on-month basis where we take the tablet every day for a period of between 21 to 24 days depending upon the type of pill, and hence it helps you get a regular cycle, helps prevent pregnancy. It has also got many non-contraceptive benefits which your gynecologist may consider at other periods of times. So a contraceptive pill, definitely what is available nowadays are the low dose pills which have more benefits than side effects, and if not tolerating or if there are other risk factors present, your doctor will screen you and advise you whether you are eligible to take it or not. The intermediate acting methods are generally done as spacing after one child is born, so that we have a long acting reversible contraception where these work on the method of putting it once and forgetting about it, because on a day-to-day basis you may not remember or your schedules may be different after having a baby to take a pill on a daily basis or having something to be taken regularly. The long-acting reversible contraceptive options are either a copper T which is inserted into the uterus and helps prevent a pregnancy by occupying place in the uterus and making the lining unfavorable for pregnancy. The other hormonal methods are Implanon or an LNG-IUS, also known as a Mirena. Both of these, the Implanon is inserted in the hand and helps prevent pregnancy. It's got a spacing method of up to 3 years, whereas a Mirena or an LNG-IUS is placed inside the uterus like a copper T and it works up to 5 years. So the ones outside the uterus are the Implanon, which is inserted into your hand and prevents pregnancy for a period of 3 years, whereas the copper T and the Mirena are inserted into the uterus and have a period of activity between 3 years up to 10 years for a copper T, whereas for 5 years up to a Mirena. So these are the spacing methods where once you insert it, you don't have to keep it in mind or you don't have to take any medication regularly. They work on their own, and when you're planning another pregnancy, you can get the instrument or the Implanon removed and then plan another pregnancy. The other permanent methods of contraception are a family planning surgery, which can be done both for the male as well as for the female. So in the male, it is known as a vasectomy. It's a simple daycare procedure and that is done by a urologist or a surgeon, whereas the family planning method for the lady is known as a tubectomy, which is done by the gynecologist. And these both are the permanent methods of contraception which can be done both in the male as well as the female. What is done in the male is known as a vasectomy. It is a daycare procedure done by the urologist or the surgeon, and it's a simple daycare procedure. For the female, it is known as a tubectomy. This is done by the gynecologist. Both of these are permanent methods. So before opting for a permanent method, please ensure that there's adequate age of the child and we are sure about the decision regarding family planning, because once done, reversal can have its own disadvantages and difficulties. So happy choosing, because it is you who as a couple need to choose what works for you, but being aware of the choices you have are important. Definitely meet your doctor to know what would suit your needs and choose. So happy choosing, happy contraception, happy spacing. It is more important to prevent a pregnancy rather than terminate a pregnancy. Thank you.